proposal to see if we could get that to work and that we could actually move that shelter project ahead of schedule by about, I think we said 12 to 24 months. But he's going to come. I did send a copy of the proposal out. We have some hard copies here if anyone wants one. And when he comes, then we'll give him the microphone, I guess. So let's open the meeting and I'll offer, or I'd accept a resolution to approve the minutes from September 14th.
Pledge.
Oh, I'm so sorry. It's pledge allegiance to America. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, so I'll entertain a motion to approve the minutes of September 14th.
Move it, Lydia.
Second, Brian. All in favor?
Aye.
Okay, we have no appointments tonight. We do have 11 resolutions. We have 3 from the Health Department, 4 from the Department of Social Services, 3 mental health, and 1 for Office for the Aging. But just to shake things up, I asked Deb Dennis to come and see if she would like to talk about anything on her update. And you can ask her any questions, even though you don't have any resolutions tonight. I know it.
I have one thing to add to my update for the committee for this month, and it has to do with Student Government Day, which you all know is coming up on October 24th. The RSVPs from schools was due to me last week. I've given them some flexibility due tomorrow, but I think at this point I've heard from all but 3 of the schools. So at this point, we have 92 students that will be joining us on that day. So I'm working on getting them all distributed to the different departments, as well as the legislators for the meeting that day. So that's exciting.
1 student per legislator, is that how it's?
That's
gonna
how I'm
work?
trying to do it now. Right now, I have 12 students who've signed up, so I need to get 4 more because we're going to have 1 sit with Dave and then 1 sit with the attorney, the county attorney.
I wanted to sit with Dave. Can I ask, what schools did you say? I didn't
3
hear you. I'm
schools I didn't
sorry.
have come, and I was going to maybe mention this to you: Red Creek, Jordan Albert, and Skinny Atlas.
Oh.
And Moravia is not able to do it this year. They indicated to me they didn't have enough interest.
Okay.
Those are the schools outside the city but serve Cuba County.
Correct. Yep.
I'll try to reach out.
Okay. There's a new principal there, so I don't know if maybe he's not.
Yeah.
Mailed it to get forward. Yeah, well, I sent it twice because they switched, probably September time they switched, so I reached out on phone and email as well. So I think that we have a really good turnout and a nice variety of departments joining us that day to be able to allow the students to shadow them. Does anybody have any questions on my update?
Nope, I guess the day of the Student Government Day, you'll just bring the students in and match them with each of us, is that?
Yep, I've been in touch with Sheila about kind of how it's been done in the past as well as Lloyd, so we have a little bit of a plan. What we have done in the past is the departments, it sounds like we've done like some signage out around with the students' names on them, and that way the department heads keep their students at the different locations right outside the chamber.
And when they're done touring the departments, they'll come up here and sit with one of us.
There's specific legislators
Okay,
assigned
okay,
to you for the
all
day,
right.
and then the rest of the students will go to their departments. And then
Okay.
everybody reconvenes back around 11:30 and then takes the bus to Emerson Park where they're gonna have lunch. And Dr.
Yeah.
Brian Durant is the guest speaker for the event this year as well.
I talked to him this morning. He's looking forward to
Oh,
it.
that's great.
Just so you know, I've asked each committee chair to have 3 resolutions that they pick that might interest the kids, and we'll talk about those rather than just bundling them and grouping them through. Okay, just so you know.
Thank you.
It's just, if
Thanks, Deb.
any responses from your money, your RFPs?
I don't have any return to me yet.
Okay.
The deadline, I did put a loose deadline up of there for October 27th, just because the program year technically with this new fiscal year has already started. We'll be meeting at the Youth Advisory Board in a week from today to go over them. And we, again, have got a lot of people interested in receiving applications, whether that comes through or not. We'll see. But it's nice to, again, more and more variety of people interested in funding.
Deb, just one more question. How's your youth board going? Have you guys been meeting?
We haven't yet, we're gonna be meeting next week.
Good.
Yeah,
And
we're gonna
everybody's
take the
still
summer off
interested?
with all the programs going on, and everybody does seem to still be interested.
Great, thank you.
Next week.
Okay, thank you. Chris, would you, we will have you talk about the proposal now, and
Sure.
if you want to stand at the podium, stand wherever. I did pass out by email, and I do have some hard copies of the proposal that you had submitted in terms of if the county was interested in giving $100 of ARPA funds in terms of the shelter proposal and how you think it would work.
Sure. Yeah, so I can reintroduce the development. So we're trying to help solve the homelessness issues in not only the city of Auburn, but countywide. And homelessness kind of is at various different levels. Various point in times, you can kind of count homelessness has just been on the rise year after year after year, unfortunately. So when we first started talking to kind of this larger coalition, I think the point in time was somewhere in the high 70s, low 80s, and now it's north of 100. And initially we were talking about redoing the shelter on Grant Avenue, redeveloping property on State Street, which the city of Auburn is donating to us. We own some buildings on West Lake and Fort that are eligible for redevelopment, so we're going to recapitalize those and make them more modernized and up to today's building and design energy efficiency standards. And then we just, as of this afternoon, we were able to agree to terms with the Archdiocese of Rochester on the former Holy Family School.
This is Housing Visions.
This is Housing Visions, correct. So when you combine all these different properties and all the different funding sources that we need to apply for to build them all into various levels of housing. So the shelter is going to be emergency housing. Attached to the shelter is going to be permanent supportive housing with services and case management provided by Rescue Mission on site on Grant Avenue. State Street, West Lake and Fort, and now Holy Family School. We can provide permanent supportive housing to individuals who are experiencing substance abuse and also mental illness with services provided through the Cayuga Health Network. Not all of the units are going to be supported. We're going to integrate the supportive housing units with the general population. So as we redevelop these and you walk through the buildings, you're not going to know, well, this is a supportive housing resident, this is a regular resident. They're all going to be built the same and operate the same. These other properties I'm talking about, State Street, West Fort, and now Holy Family. We have to design these buildings to qualify with the United States Department of Interior Historic Rehabilitation Standards. That's a 2-level review process with New York State Historic Preservation Office and then also NPS. We're doing 2 developments now, going through this process, and we're on our 2nd year of receiving comments, and the state will approve it. It'll go to the federal government. They'll look at it for 3 months and then say, no, we don't like it, change it, and then it starts the process all over again. In addition to that, we're also going to apply for a low-income housing tax credit allocation, which will raise the equity to develop these other properties. This application is a 1-a-year window. There's a current window open now that ends in November 7th is the deadline for this current round. And then after this year, there's 1 round per year, and that's going to open June. And it'll be open every June thereafter. And those applications are competitive. The last couple of rounds, there have been anywhere between 85 and 90 applications. And the state only has the resources to fund maybe 19 or 20. So there's a significant backlog of developments that the state wants to fund. It's just, you kind of got to wait your turn. So when I mentioned in the letter that if we include the shelter with all these other properties, and we go through not only the preservation approval process, but also the low-income housing tax credit allocation process. By the time we get a funding award, get the designs finalized, get building permits, get our equity investors due diligence and close, it could be as late as 2027, 2028, honestly, before we break ground and start construction. What our request for ARPA will allow us to do is if we're able to receive an award for $1 million of ARPA funds, we can apply to the Homeless Housing Assistance Program, which is designed to fund emergency housing. We fit within the parameters of one application for the shelter component. We have a new design working with Rescue Mission and Beardsley Architects. We have 82 shelter beds now. So we've increased the count from where we were before to 82. So we're going to be able to house 82 people every night in that shelter. And we were able to build 9 permanent supportive housing units. They're smaller, but there'll be 2 per floor, or I'm sorry, 3 per floor. So we'll have 9 permanent supportive housing units. So 82 beds, 9 units, all on Granite Ave. The HHAP round is different than the tax credit round where it's an open window. So we can apply today if we want to, or if we were able, we just need site plan approval. The city have our construction budget, we can submit. So with the allocation of ARPA, we can apply to HHAP and we could have an award as early as first, second quarter of next year. And then finalize our design and start construction maybe fall of next year, which is a heck of a lot sooner than 27, 28. And I think it'll help Christine and her organization on dealing with the homelessness issues every night until we get the shelter built. So.
And I guess, Chris, you had said that, because of the need in this community for the emergency shelter, that would really bump up us in terms of being eligible for these HHAP funds.
And it will score very high with $1 million commitment, along with the 250 that you've already generously given sport due diligence. So community support, as well as what they call leveraging, where you're leveraging state funds to upset local funds, it will be looked at.
And I guess I'm confirming, if we don't do the other pieces, the grant or the State Street, the scattered sites, all of that, we're still going to end up with a problem because you got people in emergency housing and eventually you got to move them to some opportunities in this community. And that's what the rest of this project is,
Yeah, our
providing
hope is
additional.
to get them out of the hotel, get them off couches, get them off under bridges and per benches. Just get them in the shelter and then get them services, whether they're once a night, but then the goal is once they get services, we can get them approved, and depending on their level of need and care, there's 9 units on site, which are the most vulnerable. You can just keep an eye on them right there. But then between Westlake Fort, State Street, and Holy Family, we have a lot of case management space in the school and in State Street, where we get them in a 1-year permanent apartment with services whenever they need them. And then, they can stay there as long as they're a good tenant and, get renewed every year. And then ultimately, market rate apartment or buy a home. That's our end goal, is to get everyone out of our homes and into homelessness. So it's got to start.
Chris, can you explain everything about the security and food and everything else that will be included in this?
So the security and food, it's going to be run by the Rescue Mission, and they have submitted kind of an operating budget, which includes 24-hour security, but also they contract with local police to have a presence there at all times. And reason the bed count changed is that rather than having individual rooms with doors, the 3 floors of the shelter are going to be wide open. So not only can cameras see everything that's going on, there's room for security on each floor to be able to see every person on that floor.
Which one is this?
This is the shelter on Granite.
It's not,
Where exactly is it?
Yeah.
Do you mind me asking?
You know where the
There's two.
Verizon?
Yeah, the
store?
one right next to it?
Right there.
But how many can that,
16 now, right?
16?
Right.
So are you
I
gonna,
think so.
so you're gonna renovate that?
We're gonna knock the.
Level it down.
Knock the buildings down, re-level it and build a 3-story building where it is now.
I do got some questions.
Yeah, go ahead. Yeah.
You said it's about 107 people that we have registered as homeless?
At the last point in time count, that's my recollection. Others in the room might know.
It's higher than that. It's higher
Okay,
than that right now.
That's
So-
not who you're sheltering. That's who they counted.
The point in time count is for people that are homeless out on the streets.
Yes.
It was 100, what was it?
I thought it was 126.
126?
It was.
so when all these properties are renovated and up, how many beds will that serve? And is it permanent or is it something that they're looking for a space for? Or is it something where families or individuals? Like, I don't, but sometimes, if you.
Yes.
That's all that, okay.
So we try not to build just one type of housing on one location. We try to cater to the housing needs at any time, and there's needs for emergency housing, transitional housing, supportive housing, and permanent housing, what we call workforce housing or general population. The shelter will exclusively be emergency housing and permanent supportive housing. The other properties listed here, Westlake, Fort State Street, and Holy Family, will include a mix of permanent supportive housing and workforce housing.
And so you think that we would be able, not, obviously, if they would have to agree to this, but we can we can actually have 125 beds or, or whatever the demand is.
82 is what we can fit on.
How many?
82.
82. So there's 82 in all the properties?
No, there's 82 emergency shelter beds on Grand Avenue.
Okay, and then when the one on that you did, the school, that's gonna be more permanent living?
I think,
So in the letter I wrote for former Holy Family School, adaptively reuse it into 18 to 20 permanent housing units. And again, that's subject to chivalry. And there's also a gym and some other facilities in there that I think there's a need for in the community. We just haven't found the right person to discuss that with. So there could be some additional perks to the school redevelopment. Westlake and Fort, there's 12 apartments in there now. We're looking to maybe increase that to 16 to 18. And then State Street, we're looking between 16 to 20 units in there as well.
I gotta tell you, I've never been homeless, but I've had a lot of friends that were. And this is a very good thing. Anything I could do to help, if there's any boards or anything you want to. This is a great effort.
Thank you.
lady first and then you do.
Let you go first. Thank you.
Ladies first.
Thank you for this information. I have two questions. One, I'm not sure if it goes to Chris or if it goes to somebody else, but what will this do to the hotel requirements by the county, by the state, however that works? And we all know that we have people waiting at the borders of our county for the weekends to come in and hang out at our hotels. Will it decrease the requirements that we're going to have to hold for those circumstances?
I guess a couple things. I just went through this again with the Department of Social Services staff, because there is this presumption that the people that were housing in hotels did not have a last known address in Cuba County, and that isn't really the case. I asked Christine's staff the other day, I said, could you just give me another point in time count? She said at that point they had, I don't remember how many people in hotels, and they were housing 2 small families. Those 2 families had an out-of-state address, but they came in to visit relatives in the county, and somehow they ended up needing to be sheltered. Everyone else no one else was not outside of the last known address outside of the county. And the message was, they'll come from out of county, the department works with them to get them back to the county of their county of origin. So that there is assumption that we are just, I guess, county easy and all these people are coming in for hotel stays. I do think if someone is offered a hotel versus a shelter, some people may not want a shelter. They certainly may not, but if we offer them a shelter bed and there's no interest in that, we have met our obligation to that individual.
Right.
We don't have to say, well, never mind, then you can have a hotel. We just want to get people out of the hotel business or people out of the hotels. And Christine was telling me today that one of the hotels who was taking some families for us just gave notice that they're not going to do that anymore. They're too much for the,
Yeah, they just feel that they're not equipped to handle the families.
So this makes this all the more important.
yes, that's how
Thank
I,
you.
yeah.
And then the,
Yeah, we
excuse
can-
me,
I'm
one
sorry.
more question, please. Additional costs to the county going forward, if we do this, are there any associated or are we, this just takes care of the need?
The operating costs of the shelter, once it's built and running, I think will be a contract between the county and the operator.
We'll either pay per diem or we'll give an annual fee. That has to be worked out,
Yeah,
right?
so I can't speak to whether that's where that number is gonna be.
Well, you gave me more information than I had, so thank you.
Will Franklin Street still be operating? They hold,
They can still operate.
they have 16,
I think that's their.
15?
intention.
so there'll be this 82, and there'll be that 16 or 19 bed shelter on Franklin
I'm
Street.
not sure how many are.
Yeah, I
They
think
have 15.
15, okay.
Thank you. Thank you.
Chris, that's great about Holy Family Church. That's outstanding because that's been sitting vacant for a couple of years now. Nobody's going to use it. So this is very,
Yeah, I think it's well located. I think it's a great layout for a supportive type of operation there, given
Mhm.
how the building is laid out. I wish it was a little bit bigger, but again, 18 to 20 is probably manageable for any type of population that we want to put in there.
and it's got a kitchen. I mean, it serves, it was a school. I mean, it had a gym, as you said, or still does. I mean,
It still does. Yeah, I almost think I.
Okay. Heidi and Christina and Heidi, there's two Heidis.
Hi. I just wanted to ask Christopher if this $1 million ARPA ask, I want to make sure that I read the proposal clearly. It is for the Grant Avenue demolition and reconstruction, correct? It's not for the other scattered properties.
Correct. In looking through the ARPA regs, I don't think the other ones are eligible, but emergency shelter housing is eligible for the ARPA funds.
Okay, thank you.
Yep.
Christina?
Yes, I was just, Westlake and Fort is my district and also my neighborhood. Is it the white apartment complex or the brick one?
The white in the. There's
On
three
the side
buildings.
is on the same side as the cemetery?
yes.
Yeah, so 3-5 Westlake, 8-10 Ford, and 12-14 Ford. The one white one that looks like it's kind of slanting over.
Uh-huh,
We had a structural engineer go in there, because when there was a historic preservation conference here in Auburn, last spring, or this past spring, and I was able to get some of the senior level folks at SHPO to come look at this property. I'm saying, look, it's kind of leaning over. We want to perhaps demolish it and build something new in its place. And they said, well, in order to do that, you need to have a structural engineer go in there and determine it's not structurally sound. So we were able to do that, and we've submitted that paperwork to SHPO. So we're kind of in the middle of that process, but our goal is to rehab all three of those properties there.
okay, great, thank you.
I mean,
Yep.
will these properties, Chris, will they be taxable? They're not, or will they, or won't they?
I don't believe the shelter is.
The
but
others,
The other properties that, the permanent supportive housing and the permanent housing are taxable.
thank you.
And, just to, not to beat this to death, but this all started because I guess Lynn had heard that some of the ARPA funds, or they have expanded the category for the restricted ARPA funds that had to do with some kind of low-income housing or something. So we reached out to Chris and said, well, gee, if that's the case, is there anything that, you think you could do to deal with the housing needs that we have in this community a little quicker? And you reread it and said, well, honestly, it's the shelter piece that would make the most sense if we pulled that out, and it would be ARPA eligible.
Right.
And it would address, I guess, the biggest need that the county has right now.
I think one of the biggest financial burdens you face.
Yes.
So.
Behind you all. So 2 questions. One, how far does the $1 million get you?
The $1 million gets us to be able to apply to HHAP within their funding requirements and build the Grand Avenue site.
So that,
That's all.
that alone, or is it with this other grant? Is it they're
ARPA and HHAP together.
together?
Yeah.
So was
But
that,
HHAP
is that
will
a
work on its
matching?
own and ARPA will work on its own.
Right, is that a matching thing though? So if you get $1 million from us, we get $1 million from them?
No, we're getting $1 million from you and $8 million from HHAP.
Like those.
Approved.
Right.
So, okay, I just want, because people ask me, what?
Yes. Now you're leveraging your $1 million into $8 million, and
Into
you're
eight.
getting a $9 million shelter 3 years ahead.
So
of
that's
schedule.
important to know.
Yes.
Yeah.
Yeah.
What happens with the rest, since you said you're pulling this out? So is this once packaged up as a package with all these different buildings? And now that's gonna start a new set of grants for those other buildings? I'm trying to
Just think
figure.
of the shelter here and all the other properties here. They were going like this and now it's going like this.
Oh,
This is
okay.
not stopping. This is still going.
Oh,
This,
okay.
the other buildings still have to go through the low income housing tax credit program. So we're targeting to apply in June of next
So
year.
they weren't all bundled as one and
They
then
were.
They were,
This $1 million will
pull it.
separate them.
Okay.
That makes sense.
Very exciting.
I'd like to know, Dave, or if Lynn or something, the cost that the county has presently with what we're doing with hotels.
Christine can tell you that.
And then what our cost will be to the housing people for this. I don't know what to call it, this homeless shelter or shelter.
That's what it is.
You know, where it's gonna be one big room or something.
Christine, can you help Jim with that?
But we're spending about $110 a day for every person that's housed right now in a hotel. Right now, we have
God bless you.
Central Hotel on its own. If we do that all year long, we're spending $1 million just at Central Hotel.
So that's important information.
And then there's all the other hotels on top of that. So I mean, we're
But-
spending
Can
millions.
you repeat that?
Some of the folks don't get
He didn't
reimbursement.
hear you, Chris.
Oh, sorry.
I heard something like $100 something.
We spend about $110 a day per person that's housed in a hotel room right now.
Per person, per family.
Well, families sometimes take 2 rooms. An individual would take 1 room,
So 110,
110.
and how many, that's 127 people?
We had, the last count was about, I think 100, I have it here, about 110, 111 people and about 30 families. So we're housing a lot. Some of them are housed at the Chapel House, some of them are housed at Family Transitions, but we have a lot of people at hotels. And what I said is like right now at one hotel, we have 31 units being taken up. So between families and individuals, we're buying 31 rooms a day at that one hotel.
13,000, wait a minute,
Yeah,
110.
a day.
Use all your fingers.
Yeah, it's a lot. It's millions of dollars.
The other thing, if I can add to that, is not only are you paying to put them in a hotel, but when they're in the hotel, they're unsupervised, they're not getting services.
Right.
When we build the shelter, there's gonna
Well,
be,
the hotel people are probably pretty happy. The hotels are staying there. Are they getting $110 from anybody else? Or it's just the county? 110.
It's $1.25 million for 31 people to stay for a year.
Elaine,
Times,
can I say?
No,
you know,
And Christine can answer this better than I can, but one reason I'm totally for this thing is, Chris just said it, they're unsupervised in these hotel rooms.
13.
When they come to the shelter, they're gonna be supervised. And the ones that aren't behaving themselves, that don't want to behave themselves, will not be in the shelter anymore.
Correct.
They will not be offered anything anymore. And every time they cause damage to these hotels, the county pays for that damage. It won't happen at the shelter because they'll be arrested. So there's a total difference of, that's a lot of money.
This isn't totally a punishment to be in the shelter, but some people have pretty significant needs that you gotta
Absolutely.
wrap
Yeah, I
services
used to stay
around,
in
or
mine
it's
for
gonna be a
$2 a night.
revolving door.
But some people are just using it that won't go to this shelter because they're gonna be watched 24 hours a day. And they don't want that.
Yeah, I still have a question. My other, the follow-up question to that is what's the cost per bed when we're at the new shelter? Because the delta is what is gonna be, what we need to show people and stuff. Not only are we getting 8 million for 1 million, but we're spending on 31 people, 1.25 million a year.
You pay more than that. 13 million.
No, you're adding the other 111 people.
No,
This
31
would be the
people are staying at the
31.
hotel.
Okay.
So what's the delta of that to say that this, getting them out of there? But let's say at the shelter, I'm gonna make up a number, so don't, everybody on Zoom, don't go crazy. Let's say it's $50 a night to support them at the shelter.
Mhm.
So the delta's $60, you're saving.
But in addition to that,
continual-
if it is $60, you're also getting meals, you're getting
Security.
supervision, you're getting medication, you're getting isolation rooms if they need it.
Right, they're getting
and
care.
24/7 security.
Right.
So less police calls, that again is at hotels, it's a cost to your county and city.
Associated
Yeah, I'll
costs
say
are.
that.
I'm just trying to
No,
build up
and
data.
I think
So it's hard just to look at.
Christine and I have talked about this. I don't want to be, neither does she, standing up saying, if we have this shelter, gee, the county will be spending a fraction of the cost on emergency housing, because I don't know that that's true. Because depending on how much their operating budget is to include all of the things they're going to include, we don't know that yet, and I don't know, well, I can't say, well, it's gonna be dirt cheap, because it is going to be a far better way to deal with people in emergency housing needs in this shelter with the supports that come than it is to just put them in hotels. So, but I know what you're trying to say, and I wouldn't want to mislead you to say it's going to be this much cheaper, and I know it. I don't know that we do know that, right?
We have people
No, we
asking
don't
us
know.
for the data.
Yeah,
So,
that's why I was
but
trying
there
to get some data.
but there are associated costs that are kind of hard to quantify.
And we have additional case management costs that are going to be built into this.
Right.
That we're paying, you'll see some of the contracts today for case management for people in hotels, people in Ray of Light or whatever it's called, but yeah, so all of this will be centered in one. So what the cost is gonna be, I mean, they're gonna at minimum want the county's contribution to cover 90% of their operating costs. At one point, that's what they said. We're not going to operate the shelter for you with everything we put in and lose money. So that has to be determined, but a homeless shelter versus hotel rooms,
I was just gonna, if I could
yeah.
add something, I mean, we have people we're trying to do a really good job as far as mental health treatment in the jails, in people trying to maintain recovery. Being in a hotel with no supports whatsoever is not the answer to that. And I think being able to provide all those wraparound services in a shelter where there's supervision, you're gonna have people that are gonna be in a much safer position to be able to gain their recovery and stay in that place. And I don't know, from my perspective, that's what I'm looking at, is people will be able to be more successful with their lives if they're not in hotel rooms with, drugs and other things with no supervision and no wraparound services whatsoever.
It's a
So
stronger, longer term solution.
we're setting people up, I think, by doing that. And I think that's our best option right now. Don't get me wrong, but I think we can do a lot better.
I think the jail was looking at a community-based organization renting apartments for people when they transition them out of jail, because they know if they send them to the Department of Social Services and they go to a hotel,
People coming straight out of rehab sometimes don't have a place to stay and they're going into the hotel. And they just did all that hard work in rehab to go and do that treatment and then they end up in a place where they're really it's very difficult to maintain recovery in that environment.
Christina has a question.
Christina?
Yeah, I just wanted to point out also, while taking care of everybody is really important, and I'm glad to see something like this moving forward, is the benefit of getting people out of the hotels that don't necessarily belong in there for this reason. Our tourism is important to our county, and if we're taking up rooms in our hotels and the hotels are getting damaged because we're having to do this so often, that's hurting our tourism dollars also. So this has an added benefit outside of just helping people get what they need.
That's an associated cost.
I guess that.
Great presentation.
Yeah.
Well, I mean, you've been here several times, at least at our meeting,
Better, so.
maybe not in front of the ledge, but
Sick of hearing me
But you
talk.
do a great job. It was, everybody needed to hear this.
Sure.
I wish all the legislators were here, but
Well,
We should have him back for the ledge meeting.
well, I was going to ask you if there was any interest in having this actually move out of this committee and come to Ways and Means or to the ledge meeting, potentially with you coming. I think I have circulated this proposal to everybody on the legislature. Is timing of the essence or no? I mean,
Yes, he said November.
Move it to vote.
that'd be great, Lydia.
The critical
a
path
resolution.
for us is the.
Right, I hadn't put it on the agenda yet, so.
Okay.
Yeah. Pardon? Sorry.
The critical factor is the city site plan.
The critical path right now.
And that you'll do once you know the county's on board.
We're gonna do that regardless.
Okay, okay. And you foresee a problem with that?
I always do beforehand, but we've had a couple meetings and we've addressed some of the site comments, but you know,
Elaine, let me ask you a question.
Well.
I could certainly invite Chris to the full ledge meeting, so everybody knows. Do you want to do that, or can you explain it?
I
Or do you
have-
think Chris should
I
be.
have a resolution that Rich has looked at in anticipation that there'd be interest in moving this forward. I can hand it out tonight. We can put it on the agenda. I don't know. It doesn't matter
I
how
don't
we
see
do
a
it.
reason for delay.
Okay.
Move it to-
I don't either. I think it should be passed this month,
when is
the
your?
24th.
That's student government.
Which
That'd be great for.
You can
that would
still
be
have a
great for student
presentation.
government
Yes,
day.
it was. I was
Sorry.
just thinking.
That would be great for student government.
Yeah, I agree with you.
Would be.
Why don't we do this? Chris, I'm officially asking you to come on the 24th, all
I
right?
do have a question.
But it's not a night meeting, it's a big
October
Oh.
24th at 10 a.m.
10 o'clock meeting, and that's the only one of the year that's.
It was a night.
Yeah, we're doing eggs Benedict. It's gonna be great.
But you would go to lunch after maybe. You don't eat much.
Are you available that day?
I am.
All right, why don't we plan out, Sheila, could you put him on the agenda for a presentation?
Absolutely.
So Chris, if you could be here, we'll do the pledge at probably 5 after 10. I'll
You
put
want
you
to
on
send
first
a
thing.
PowerPoint or anything else for your presentation or something?
Some of the numbers, if you could get some of those numbers together. Numbers of people,
Is my
hotels,
motion
costs,
going to say
the
that?
1 versus 8, what that's gonna do. I think just a few of those stats would be helpful.
I could maybe put a little PowerPoint bullet point.
Yeah,
If you want to send it to me,
Bullet points.
cubancounty.us, I can get that put up.
Excuse me, Madam Chairwoman, I'd like to move the resolution forward, please.
Okay, could I have a second for moving a resolution for this?
I'll
million?
second it.
Okay,
Discussion.
any discussion?
ought to hand it out. What column of the ARPA is it coming out of? Do we know?
It would be eligible, Jim, for the restricted funds. It would be, but which is he has 2.4 million or a little above. It would also be, the county can do whatever with the 4 million they have unrestricted. So it could come out of the restricted fund because it would be eligible.
Absolutely.
Yes, yes.
Okay, just, I don't know if that needs to be in the resolution. That can be a decision by the ARPA committee or the ledge.
Here is this.
well, that's a good point, Jim. The ARPA, the four of you should get together and tell us what it's coming out of, so we can make that vote on the 24th.
I think-
Christine and Bob are not
Matters,
very
does it?
cooperative.
Whether it's coming out of restricted or unrestricted, that's.
It doesn't, but I mean, Lynn has to know.
Yeah,
Yes,
Yeah.
yeah, but we don't need to vote on that.
No, we don't need to vote.
But it has to be in the
It
resolution.
has to be, no, it just needs to say it's coming out of ARPA funds.
Yeah, but you can ask Lynn. I'm sure it has to be in the resolution
We
where.
get- I don't think we've ever said restricted or unrestricted, but if we get,
By what it is, I think it tells us.
Well,
But we can check, we should.
yeah, I checked with Lynn, but I think it should be, but that's up to Lynn. It doesn't matter for Chris. Chris, we need to have you here if you would
Okay.
do that, all right? We'll give you like 15, 20 minutes, all right?
previous
resolution that
we did for
Must be
Was
somewhere.
it bugging you?
50,000 did not
Thank you for fixing
I know,
it.
you know, we did not.
actual.
Set our account.
ARPA funds
She's a building.
Uh,
He
are
built.
gonna have to amend the contract. The 250 was for pre-development. If you recall, that was the pitch at the time. This is for development, so we just want to make that clear that, the purpose of the funds has now expanded.
okay,
But you should pass out the resolution,
I
so
will.
everybody here actually sees it before you vote on it.
Thank you for stopping in.
Yeah. Thank you. We'll see you on the 24th.
Thank you very much.
thank you.
Project.
That was my whole reason for coming. You don't be mad if I leave.
No.
Elaine, I'll put that on the ways.
Don't get mad.
Okay. And that will be whatever HH you refer to it. Yeah,
Good job.
Elaine, you will be sending that out to everybody before ways so they can all see it,
I can email it out to everyone.
or somebody.
Sheila will.
Yeah, all right, thanks. Chris, thank you.
Well, if she amends this, yes, she can say it was.
Explains me back, it's gonna go out tomorrow and it's gonna be in it.
Okay.
Okay. All right, that's great. So Lydia recommended we move it forward. You second it, all in favor. It was all in favor. Okay, all right. All right. I do think it's really exciting though.
I'm really excited about it. Yeah.
It's great. It moves it ahead 2 years, 3 years.
Yes. Okay, if we go forward with our agenda, Brenda, you have one resolution. It's H11 if you want to present that resolution. Yes, if you want.
Okay. So this resolution is, since I was last here, it's hard to believe it was only a month ago, but our meal vendor, when I was last here, I told you we were having an audit from the state on our meal program. Our meal program's wonderful. Everybody loves the food, but the dietitian determined that the food wasn't as healthy as it should be. And long story short, our meal vendor decided not to work with us any longer. So normally we have a much longer time period to get a resolution together, but fortunately, we were able to do this. We were trying to move forward very quickly to get an RFP out and do a contract with a new vendor, because there's a ton of moving parts for a meal program. You know, we have 15 routes, 3 locations in the city, 80 volunteers. It's just a major operation. So over 75,000 meals a year. So this resolution is to do the RFP. And when that comes back, the bids come back, open them, look at them, make a decision and move forward with the contract. So we can get this all resolved hopefully as soon as possible.
Nightingale, move it for discussion.
Second.
So second.
Great. So this is just allowing you to go out to RFP for your meal program. That's going to end in December. Okay. All in favor? Any questions?
Yes. I want to see the report on what wasn't nutritious. These people,
It
this
was
might be the only meal.
potato
that-
chips and chicken patties, or right? There was, yeah,
And tater tots.
My favorite.
that's what everyone said.
Some restaurants put out tater tots and they actually make you pay for it.
Yeah, that's true. We get quite a bit of money from the state and the feds for this program, so we have to follow their guidelines.
Who's the nutritionist? Was that
New York-
ours?
New York State Office for the Aging evaluates us on fiscal, on nutrition, and all of our other programs. Yeah, our dietitian.
Are we set on this one, Sheila?
No, we need all in favor.
All in favor of the RFP for the meal program?
Aye.
Any opposed?
And I just want to thank
God bless
Corinne
you.
here and also Amanda for their work to put that RFP together because it was done really, really quickly. And we had an old version that had been, I think, changed a zillion different times. And we tried to improve upon that and also incorporate all the new information that the dietitian had given us in this new RFP.
And what about the round of applause for your junior accountant?
Oh, my goodness, I'm so happy to have a junior accountant.
Since January, right?
Yes, so thank you again also for the work to get that resolution in at the last minute because she started and, probably started a month earlier than she would have otherwise. And we might, hate to think it, but could have lost her. So I'm really glad.
Great.
Yeah.
Okay,
Good stuff.
good job.
Sort of, except for the meal program. Just a couple of quick other things. I did finally put a report in and some of it's duplication. I did talk about it last time. Let's see. Yeah, I guess, unless there's any questions, I guess that's pretty much what it is. I do want to thank Elaine and Dave and Shireen's, everybody's work to preserve our county employee parking at the HBO lot is to the extent possible. I think it's as good as it's going to be at this point. So that's great. I appreciate it.
Thanks for your
Appreciate it.
patience.
I got one question. The Meals on Wheels program, that's the entire county, correct?
Sure is. Yep. Makes it tough.
That's what I thought, because they said that I was at a meeting today and the Office of the Aging doesn't support District 1. And I go, oh, they got the scat vans come up, they have the Meals on Wheels.
Somebody is misinformed for sure. Yeah, we have a kitchen site up there, a site manager,
Right.
deliveries.
They said, oh, they come up twice a year as a courtesy or something. Never missed.
No.
Thank you, Brenda.
Okay.
All right.
Brenda,
Thank you.
appreciate it.
Okay, Kathleen, hopefully we can get through all the resolutions. I'd like to kind of group together HH1 and HH2, and then we can ask any questions on them and move them, the two of them together.
That would be great. So HH1 is a request to rescind a former resolution to fill a nutrition position within WIC that's 100% covered through the WIC because we actually have someone who held the senior nutrition program or nutritionist role previously, who is now able to come back to work, and that is the ideal person, and it can be covered in the grant. So that is our request for HH1. HH2 is a formality so that we can pay money to our information technology department for provision of services and claim it through our state aid afterwards.
Get a motion for HH1 and 2.
I'll move it.
Second,
Nightingale, second.
okay. Is there any questions on either of those two? Okay, all in favor?
Aye.
Aye.
All right. Anyone opposed? I don't hear any. And then HH3, this is what you talked about last month, purchasing this additional software with some incentive money is.
Yes, we have money that we've gotten through some district funding. And rather than build this request into our 2024 budget, since we have this available now, we'd like to make the purchase, which we were hoping to do in January regardless, to purchase the part 2 of the preschool special education billing and tracking system. It's called McGinnis. We have part 1. We started it on July 1st. It's going well. This will provide a tremendous benefit to our staff who work in this program and to the providers and the school districts that have to be engaged. So the school districts can upload all of their information directly into a portal, which automatically populates the system. The providers are currently uploading their information into the portal. The two will marry each other. Our staff can go in and say, great, all the information is there. We can process the necessary billing. We can do our quality assurance. We can not jump through as many hoops and have as much data input and paperwork, and it'll be highly more efficient and more consistent.
Could I get a motion for HH? Is it 3?
I will also add that I spoke with our information technology, Tom Bunn, and he's supportive of us moving forward. And we'll, of course, discuss with Greg.
And a second for HH3?
I'll second.
Okay, any questions? All in favor? Right?
Aye.
Good, thank you. Okay, that's really your 3 resolutions, right?
Those are my 3 resolutions. I will say this will be wonderful. We'll fill our nutritionist position by the end of November. We're setting up interviews for our health educator role. So that leaves our community health services director position. So moving forward, before the end of the year, we hope to be really there. And then just to comment on a couple of things, we've had a few activities. We had a successful drill yesterday providing flu vaccine for county employees. Our drill had to provide accessibility issues. So not only did the physical layout had to be accessible, but also if there were sensory needs, not just physical limitations, things like that. I think people were glad to be able to receive their flu vaccine. Also, it was very convenient for staff. We've had some people going to some trainings lately, which is great. I was just earlier today at an immunization regional consortium meeting where I was asked just to say some closing remarks because we want to have local people in there. But we sat through the afternoon sessions and it was really very well attended and great information, national information, local information. It was really ideal. The WIC benefits I mentioned last time, a concern whether they could be diminished. There has been a resolution that was passed so that the higher level that people have been receiving the last 2 years will remain through mid-November and then see what happens. We had a lot of the walk to school things. We were just talking about that beforehand. The final walk to school events were this week at Weedsport, Moravia, and Port Byron. And I think they're well attended and they are welcomed. And I have some updated lead information. We're closing out our period 2 of our 5-year lead grant. And I think lead poisoning prevention is getting a lot of great attention around the state, but around the nation. And there's a lot of good things happening to improve environments, particularly for children, and to ideally diminish lead poisoning amongst children. Just looking at the data that was shared with me, we had this past year, we conducted 97 home inspections. 49 were associated to an elevated blood level, so reactive. 48 were proactive. So we're this close to kind of flipping the switch, as having more people saying, come in and let's fix the problem before there's a problem, right? So I'm really looking forward to this next year. We had 111 children receive lead tests by us through our WIC and Head Start program partnerships. So that's really great. Our lead poisoning prevention staff have gone to a number of meetings. There was an annual meeting in Albany where numerous counties were represented. Our staff were asked to do a presentation on the No Home for Lead. That was a marketing campaign. It was well received at the meeting, but you're seeing, I think, the billboards, and you saw some information last month I dropped off. And we're still waiting to get more information. I think to be determined still about the rental registry that is being discussed at the state level. So more to come on this.
Great, thank you.
Thanks, Kathleen. Yeah, for open.
You have 4 resolutions, and if I'm not mistaken, the first 3 are contract renewals. 4 is the filling of a budget of vacancy. So if I'd like to be able to group together HH 4, 5, 6, even go over them, and then we'll move them as a group and get a second and open it up to questions.
So HH4 is for us to enter into an agreement with Cuyahoga County Mental Health to perform assessments on children that we have placed in residential treatment centers. In order for us to have children stay past a short period of time in a residential center, they have to have a qualified mental health clinician with a couple of years of child welfare experience, do their own independent assessment of the child's needs, report that out to family court to have the judge be able to whether or not the child needs to remain in that level of care. Mental health has been doing these for us the last few years. I talked to Lauren, she's still willing and has staff to do them. It's $100 an hour, up to $2,500 for one youth. HH5 is for us to enter into, renew a contract really with Chapel House for supportive case management. Last year, or up till now, we've had a contract with Chapel House to do some case management. The contract was larger. It was $140,000. We're asking to drop it down to just a little bit under 80,000. They were doing some work for us embedded here at the department. That was really not working out for them. They asked to kind of back out of that portion of the contract. They would like to continue to work with us on helping us manage the case management of the hotel population. So this contract for the 80,000 is for them to work with my team here. We would assign them cases. They would be assigned to people that are in the various hotels, with them on, meeting their needs, trying to hook them with services, trying to help them find, permanent housing, take care of that. And then HH6 is for us to contract with Chapel House again for the Ray of Light emergency shelter that we just talked about on Grand Avenue. So that is a contract that we've had for years. We're finishing up on a contract that went from 2020. And I'm not sure, Ray worked some magic and had a contract from 2020 through into at the end of October of 23. It did not move. That contract was for $384,615. They really were they were taking a loss every year because costs have increased so much. So this contract is to pull them up to the budget that was approved by OTDA. They're also, it's really setting them where they need to be with increased security, overnight staff, overnight shift of staff there, and case management included in the contract.
This is Grand Ave.
Grand Avenue, yep, the 16 beds.
All right.
So those are the three.
Okay, and then if you want to just add in HH7, it's a filling of a caseworker vacancy.
Yeah, so this is a budgeted position that we have. We had an APS caseworker that was out on administrative leave, and that process of working with HR and has concluded. The employee is no longer working for the department, and we're looking to fill that position. We still do have other open caseworker positions, but we're working diligently to try to fill those. I'd like permission.
Okay, does someone want to make a motion to approve HH 4, 5, 6, and 7 in second, and then we can have discussion if we need to? Okay, second?
I'll second.
Okay, great. Any questions on these? My only comment is some of this that we're doing here, once there is the shelter, would be contracts you would not necessarily.
Correct. Yep, once there's a shelter in that they have, within their budget is the case management.
All right.
That's a good question.
yeah,
So that
sure.
would be HH5.
HH5 would be case management for people in the hotels, so there should be far less people in the hotels, correct? And then HH6 is what they're doing in the current 16-bed space that will no longer be.
Right, it wouldn't be Chapel Houses anymore.
It would be
The
rescue
rescue
mission
mission operating.
operating that 82-bed shelter and providing the case management along with the overall costs.
Christine, is Rick still doing?
Rick is still, my understanding of Rick's role is more of a consulting role at this point.
Okay,
I think that they're very close to making a decision on
permanent.
having somebody that's already been working at Chapel House be their, ED. She's been assuming that role. The board may have already met on it. But he wants to stay on as a consultant.
Good.
I think that's been very helpful to them. I think that he has a lot of resources and knowledge.
So, and Chapel House knows what we're considering doing?
Yep, and they know that they still have Franklin Street. They're kind of putting their feelers out for other things that they might be able to do with veteran housing,
Good.
family housing. So they know.
They're all good friends and we just want to keep, thank you very much.
Any other questions? All in favor of HH 4, 5, 6, and 7?
Aye.
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 Great. Okay, Christine, you wanna?
The only thing that I wanted to say as an update is I have hired an attorney.
Oh, hell yeah.
So I have one attorney who's starting on the 30th for us, and that is very exciting. And talked to Rich today about that a little bit. So we're very excited to get him started. I did have another candidate that was we were holding out hope for. He actually did get in touch with us this afternoon, and he withdrew his consideration because of the commute that it would be for him. He said, with his family situation and other commitments, he said it wasn't going to work out. So disappointed, but he did get back to us. So now I know where we stand with that.
Okay. I was hoping we had two.
Back to the drawing
The
board.
one candidate didn't come from the CPS or whatever the firm? No, you found them on your own? Okay.
Came from the DA's office.
Yeah,
Not
great.
legally firm. And I don't know if anybody has any questions. I was going to talk a little bit about our housing numbers, but we have sort of covered that. The hotel that has backed out of housing families for us is going to be, that's going to hurt a little bit. We're going to have to find other ways, to shuffle things around to meet those needs.
I guess I ignorantly thought that family placements were much easier than to find. There were more family placement opportunities in this community. Not so?
There are a number of places that take families. I think what happens though is when you have a family that's staying in a hotel in a small room for a long period of time, rooms really aren't designed for that type of living. And, I think that that's what's happening is the hotel is just seeing it's wear and tear on the room. It's noise.
I just didn't think you had to place that many families in hotels.
31. Well, out of the families, I can tell you, out of the families that we have, the families are at family transitions. So the most families we can have in family transition is 7.
Is that final loan?
Yep, the Merriman. So the rest of them are in hotels. So if we have 31 families, the most we could have would be 7. So it still is a lot of families that we're housing in hotels.
Yeah.
Chris, and that's going to increase as the winter comes, won't it?
I'm not sure that the family number, our number for families is kind of up right now already. It usually was about 20, 25, and now it's 31. I think, our numbers, with code blue, with the cold weather will increase some.
Right.
Does the family unit have more available income to find housing than an individual?
They do.
Yeah.
I think that it's finding apartments and homes that are able to, within that budget. I just heard somebody talking today about nothing related to DSS, but was shocked at how much his son was having to pay for a 1-bedroom apartment. He's paying, $1,200, for a 1-bedroom nice apartment. And he said like that's more than my mortgage, and it's even less money that folks that we're working with have, temporary assistance benefits have to work with. And that's the housing market right now is, just has changed so much. I will say that there was some conversation that commissioners had with the state to push the state to take a look at the level of benefits that folks get to use towards housing. Knowing that this is they haven't been adjusted in a very long time. I think the single allowance for families hasn't been, or for single individuals, hasn't been adjusted since 1998. It doesn't meet anyone's needs anymore. You can't find a place to rent for, $200. You just can't.
What the department would allow to go
For
for
housing.
housing. Yeah.
Out of their budget.
And you follow the rules of the state. Yeah.
It's not affordable.
Who's going to train? Oh,
Any other questions for Christine?
Thank you.
thanks, Chris. Appreciate it.
Lauren, last but not least. We have 3 resolutions tonight. How about if you would go through HH 8, 9, and 10, and then we can move them in a second.
Okay. So the first resolution is just adjusting our budget for our state aid. So there was a couple of changes. One was a COLA adjustment for next ride. The other one was some reallocation of the regional money. We didn't renew a contract for respite, but we decided to give Liberty Resources more of that state aid. And then the last one is I've talked about the evidence-based grant that we got from OMH for DBT certification. They ended up giving us more than what they originally said, so it's just a budget adjustment that increased by the 46,000.
Into your own mental health. Yes, okay. All
It
right,
has to be used for specifically for that, but it's a grant.
That's good news.
We weren't expecting it, so it's always good news.
and then HH9,
Yes, HH9 is, so we,
are you getting funds from Farnham?
yes.
Oh.
So Farnham actually worked with Monica on writing some of our Narcan program into their grant application. Now that they're open and, operationalized here in our county, they wrote us into the grant to kind of cover some of our Narcan program, which is contracted out. So this is for $40,000 to accept those funds and be able to contract that service out. And then the last one is the receiving of $4 million for the SAMHSA grant that I spoke to you about last month. This is related to, there's a couple positions in there. So there's 2 therapist positions and a grant assistant position in there. So this would allow our therapists to be embedded in the schools to be able to provide DBT treatment and consultation to the school districts while they're implementing and being trained on the universal DBT approach to be able to be implemented in their school districts.
And that's the additional staff that you have coming on to assume those.
So we have 2 open positions right now, and these are 2 additional open
Yes.
positions on top of that, yeah. And the idea will be that we will sustain those positions by having hopefully satellite offices in the school districts to be able to then bill once the grant is over for the services.
Oh, gotcha. So
Down the road, if that's needed at that time, that would
they could do direct service and you could bill Medicaid or.
correct. We would bill just like we would in the clinic. They would just be a satellite in the school itself.
Okay. Okay, can I get a motion to move those resolutions in a second?
I'll second.
Any questions about any of those resolutions? Okay, all in favor?
Aye.
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 All right, thank you.
Yeah, just a couple updates, just so I did mention that Farnham is open, so the opioid treatment program is now open here in our county, which is really, really good news considering a lot of our individuals from our county would have to travel out like an hour to go wait in line to receive methadone.
This is the first time methadone's been in this community.
Ever in our county being able to offer here. And we had, I think, some of the data said there was over 100 people were traveling outside of our county to whether that was, Syracuse was the most popular location probably that people were traveling to, but that takes a lot of people's time during their day just to receive their medication. So to be able to offer it here locally, people can have other things in their life, like jobs and other things that they can do that they couldn't have done just to go get medications.
Do you get it and it's supervised?
So there's all different levels. So there's, you start, they make the judgment call based on their doctor and their assessment, but usually, yes, you would be going there each and every day. And then over time, depending, you could have take home doses. But that's their judgment based on their doctor and their treatment. But one thing that I wanted to say, the commissioner of OASIS, she's a new commissioner. She's never been here and she came to the grand opening of Farnham, and it was nice to get to meet her. But one thing that she said was, there was a really good turnout from different providers, law enforcement, everyone was there, which was really, really cool to see. But she said, this doesn't happen everywhere. I've been a lot of other places in the state and communities don't work like this. Providers don't, always support each other in these efforts, and to see the turnout. She said it a number of times in my conversation. So I just wanted to say that because it's really nice to hear and it's really true. I think we all work really well together. So it was nice to hear that from her and that she noticed that. And then we've just so you guys know, we've sort of revamped our whole mental health at the jail program. We have all new prescribers going there. We have all new social workers going there. We filled the positions and the social workers will be starting next week. But just to let you know, there's a lot more coordination and a lot more work being put into the mental health at the jail, and it's going very well so far. And I think they're very appreciative of it. And I think we just have a better understanding of the needs out there because they are increasing as far as the mental health in the jail. So I just wanted to let you know that as well. because I know we've made some increases there. So we've added another prescriber, and then we added a part-time social worker out there as well.
Because that was what Brian would talk about, that there was just so much need and so much liability to have.
So much need. I think that's across the state. They're seeing an increase of people with mental illness and substance use disorders ending up in jail. So to be able to provide them with, the appropriate services that the Commissioner of Corrections wants to see, but also that people deserve. I think that we've made some really positive changes to that. So happy with that so far, and hopefully it will just continue to improve. And then next month, I probably will be bringing a resolution forward. The Community Services Board met again and just determined that they're gonna fund for the opioid settlement funds, 3 of the 4 proposals that they funded last time. So we're gonna renew those and contract with those agencies for 1 more year. It's really hard to do something for 1 year. So we've seen a positive impact by those 3 agencies. So we're gonna continue to fund those for another year. So I'll be bringing that resolution forward as well.
Thank you.
Excellent.
I guess with to adjourn. Okay.
I want to stay.
Okay, no, Leah, here.
Give a second, though.
Yeah, second. Second,
Christina, Heidi, we hope you feel better.
yes.
Thank you.
Thank you. I'm finally on the mend, even though it doesn't sound so good.
You're really.
Thank you, everyone. Good night. For me. Thanks for sticking around. I appreciate it.
Sheila, are we still recording?